Our next speaker is Professor Ahmad Abusalah, who is Professor of Artificial Intelligence and Digital Health and Director of the Digital Innovation Hub at the KFSHRC Specialist Hospital. He's also an Adjunct Professor of Informatics at both the University of Minnesota and Al Faisal University. He has an Executive Certificate in Corporate Innovation Strategies from MIT, a PhD in Biomedical Informatics from the University of Minnesota, a dual master's degree in computer science from Purdue and the University of Illinois, and a dual bachelor's degree in engineering and information systems from Jordan University of Science and Technology and Philadelphia University. I'd like to say that he's also honorary hematologist, inshallah. I mean, from both in Minnesota and in his support for developing this BMT predictive tool. Thank you very much. Welcome, Professor Abusalah.
Thank you, Dr. Saeed. Assalamu alaikum jami'an. Good afternoon, and it's great. Thank you so much for inviting me, and it's great being with all of you. This is like one of the critical areas like for improving healthcare and part of the healthcare transformation journey in Saudi Arabia. So let me introduce number one. Like it's if you start. Okay, I think we can move with this. Okay. So as you all know, maybe like already many of you work in King Faisal Hospital or know King Faisal Hospital. It's like a large tertiary care hospital. We have like more than 16,000 employees from 70 plus nationalities. That's great from having like a rich clinical environment, but it's also very challenging when you deal with clinicians, staff, managers, leaders from different backgrounds, different educational and experience records. Each one has his own expectations, have their own like direction of managing things. So, but at the same time, it's like very, really like rich in terms of how you can address the same problem from multiple dimensions. The hospital have been recognized in multiple areas in organ transplant, oncology, genomics, etc. Has been part of the smart hospital list of smart hospitals in Newsweek. Whether we believe in these rankings or not, these days it's required that we be part of these rankings and become like one of the top 10 globally. HIMSS participations, etc., Magnet, and other awards. So let me ask number one, like it's actually not a question, it's like let's say why we are doing actually AI. It's part of the healthcare transformation journey. Why do we need healthcare transformation journey? Because expectations are different these days. Patient 2.0, I don't know if this is a scientific term or not, they just created it. Patient 2.0 is digitally empowered. Patient 2.0, he looks for the information for the second opinion before the first opinion. They look it up in the information in the internet and then come to the doctor to ask him, look, why did you prescribe this to me? I think I looked at ChatGPT and it says, I have this diagnosis, not that. Treatment plan B can have less side effects than treatment plan A. So this is actually and the patient 2.0 is very experience oriented. They're not gonna waste one full day for a 5-minute appointment for the doctor to tell him, well, look, your results are normal, and there's nothing else, like no follow-up actions. Well, the patient has transferred from one city to another, take a hotel, take transformation, etc., and wasted his full day from work or the kid from school just for a 5 or 10-minute appointment, plus 2 or 3 hours maybe in the waiting room. So the expectations is clinician 2.0. They need a super clinician. They need a superpowers, with superpowers. You have to see too many patients. You have to review tons of medical charts. You are expected to generate revenue, make no errors, and publish papers. That's exactly, if you look at clinicians in our hospital, that's why when we sometimes talk to the leadership, well, the clinicians, they don't have protected time to create AI projects. Well, that's why, because they are overwhelmed. So, and to build AI application, we need engagement from clinicians because they are the domain experts. They are the one who are going to tell us this is right, this is wrong. And that's why the Vision 2030 had the healthcare transformation program focuses on enhancing quality of care, reducing cost, and enhancing the experience. And that's what we took actually as part of our journey of building a future healthcare system. So to build a future healthcare system, you need collective genius, as I mentioned. Collective genius is that technologists, clinicians, leaders, nurses, all of them really in one room to create a product. And we have seen this like first-hand experience. We have seen the experience that are clinically driven, best by clinicians, fail. We see projects that are driven totally by technology fail. Projects that have been actually created by very strong engagement from all these people, stakeholders, in one room, and with very well-defined success criteria and ROI success are like very sustainable for 2, 3 years, 4 years. These are the projects that have been very successful. Continuous intelligence, you need an arm in every organization that will quickly scan the market for available solutions. And I would like to thank Dr. Dina before me, like very rich, very nice. You give me a beautiful, like a shortcut actually to everything I want to cover. So continuous intelligence, you need a strong visionary arm that will quickly scan the market, identify solutions that fit your organizations, solutions that are actually accepted by clinicians, leaders, and staff and technology in the hospital. This is actually a must for every organization to have it. And this is what we call transformative innovation. You need to scan the market, bring the solutions, deploy it quickly in the organization. There's a lot of buzzwords over there. Look, and I have seen like actually tons of applications done actually in publications. We have brought like AI applications and strong journal publications and in journals failed in practice. And we invited the authors to deploy it or test it. The results were very bad. And that's actually for many reasons that we'll talk about research versus application world. This is actually a lot of difference there. So the goal is to have exceptional experience. We need forward healthcare. So everything we do must improve healthcare and innovation, technology, and culture. Without digital culture and enhancing the staff, awareness is not going to happen. So in the Digital Innovation Hub in the hospital, we build like it's focused on the applied side of things. So we start from need-driven applications. Just looking which one is the laser here. So we start from need-driven problems. Any problem that we start for, it must have a proposal, and the proposal must quantify the need. If we cannot quantify the need, why we are doing certain AI project, we don't start with that. And it must have a quantified impact. If we cannot identify the success criteria, let's say we deploy a medical imaging AI, radiology AI solution. If we cannot tell in 3 months what is going to be the success metrics, we don't deploy it, we don't start the project. Because that's actually also part nowadays of the JCI accreditation. And that's like a new requirement from JCI, and it will be part also of the auditing process. So it must be need-driven, start from actual need, and must have a quantified impact. And to do this in the Digital Innovation Hub, we have 5 components. The governance, and that we will talk about this, infrastructure, human power, awareness and training, and collaborations. Why do we need collaboration? Why do we need awareness and training? Awareness and training, if we do not educate the staff on what is AI, what can it do, what cannot it do, is not going to work out. Even if we have the smartest AI application in the room, if the staff is not willing to accept it, it's going to fail. And we have seen like really applications in the hospital where actually the end users, maybe they are not pro-technology or maybe they don't believe in AI, they totally reject it. So we need to work on the educational side. Collaborations, you need collaboration is crucial. And with collaboration, we're talking about multiple dimensions. You can talk about research institutes, you can talk about innovation hubs. Startups is crucial to participate with, and vendor-based solutions. Why do you need collaborations? No way you can have a scale enough human power and infrastructure and organization to address all the AI projects initiated in the hospital. So you need to go through the vendor-based solution. Ultimately, satisfaction, sustainability, and thought leadership. Satisfaction, and I don't want you to think about just patient. I know we all talk about patient-centric organization, but believe me, most of the time, if you address the noise around the doctor, the healthcare problem will automatically be fixed. And that's what we have seen in the hospital. Doctors, they know how to treat patients, but they need the noise around them to go on. What do you mean by noise? Documentation, information lookup, data analysis, reports, etc. So if you can take care of that noise, at least that will give them space to focus on the guidelines, focus on treatment plans, focusing on patient outcomes. Sustainability, talking about financial sustainability. This is a huge pressure in all healthcare organizations. So projects with clinical care ROI plus financial ROI, these are the projects that usually take high priority and will be quickly approved by the AI Council or the Governance Council and to move forward with it. Thought leadership, we know to think about the thought leadership. This is actually part of the competitive advantage that any organization will have compared to other healthcare hospitals. Now there's a huge competition between healthcare hospitals on the patient, how we can deliver the best care. So we need to talk about partnerships, entrepreneurship, publications, trend analysis, etc. So And we put like a very strong guiding principle in our hub. Value-driven organization, we spoke about this, actual quantified need, quantified problem. We talk about responsible and sustainable AI, and this is like an AI governance, and this is one of the most challenging steps in Saudi Arabia, and we'll talk about it in a second. The regulatory excellence, and the last thing we talked about, the technology sourcing, which is, should we build, should we buy, should we partner with external vendors? So where are the areas and who are the main stakeholders that we should focus on? This is, and I'm going actually through our AI strategy in the hospital one by one. So as I mentioned, sometimes it's just like really people, they want to focus on the stuff they like, but they want somebody else to take out of the noise around them. So, and that's why we always say, it's not just about get me an AI application to treat the patient. Get me an AI application to tell doctors, this is the way to treat them. It's about actually a lot of times take care of the noise around him, accelerate research, provide tools to the leaders, to the partners, to the staff, in order to enhance the patient overall experience. These are the areas where we found AI in King Faisal Hospital actually very effective. Number one, operational intelligence. How to monitor workflows and automate them and optimize them. And we built for that like the situation awareness platform for the hospital, and we'll talk about it in a second. But this is actually where a crucial AI have been utilized. Some of the applications we receive are very simple rule-based, not AI even. Or it requires like some informatics pipelines, not even AI. But the stuff related to AI is how I can quickly summarize the documents, create a pipeline, and it creates information inside and send it to the user. That's like operational was a very honestly rewarding. Then care quality, preventive care, diagnostic and prognostic. Diagnostic, like radiology AI. Now all in the hospital, all chest x-rays, brain CTs, mammography AI, this all have been going through AI applications. This is like the chest x-rays, 124 findings are being reviewed, detected by the AI. The same thing, brain CTs. The mammography AI, in the last, I think like 1 or 2 months after reviewing tons of vendor-based applications, all of them failed. We identified like the one mammography AI application, and now it's deployed in Riyadh location and will be deployed soon in Medina and Jeddah as well. Prognostic, now one of the examples like still in the testing phase with Dr. Sayed, BMT, bone marrow transplant, how to predict the patients who are excellent prognosis versus poor prognosis. And that's actually give us opportunity. If he has an excellent prognosis, then most likely we can discharge the patient home and under controlled environment and save the hospital some resources. Experience, how to enhance the experience of the staff and patients in the hospital. So whether like virtual experience or the or within like on site. The thought leadership, as I mentioned, like innovations, talking about patents, talking about publications, recognitions, and entrepreneurship. This like has been recently added to our list. So these are some of the applications we developed in the hospital. Some we're talking about infectious disease management platform, and this is actually the first project AI we did, which is COVID-19. And that actually changed the whole experience of the hospital from total rejection of AI to some acceptance of AI to now we receive tons of proposals and we have been very selective in which one we're gonna work on. So predict the volume, services, supplies, PPEs. This is actually, and it was like, I'm very proud that during the COVID experience, the Minister of Health used almost every other day. They compare the numbers they have with our numbers to make decisions about the COVID-19 status in the kingdom. In the oncology department as well, like the system to predict the patient experience. 3 days before the patient comes, and this has been live for 3 years, 4 years, and has impactful results to the press gain satisfaction scores. Before the patient comes to the hospital, 3 days before he comes, we predict that the patient will have negative experience, and we give actions. What actions that the lead nurse needs to do. This is like in the treatment, chemotherapy and treatment and radiotherapy treatment units. And operational intelligence, for example, in the pharmacy. Our goal when we deployed this system for pharmacy workload staffing, reduce the waiting time for 80% of the patients to less than 30 minutes. So we deployed that system for pharmacy workload staffing. Patient no-show is a very classical use case. But when we did the analysis, including in the oncology department, we found actually there's like a very significant patient, they don't show up for their appointments. And that's a waste of resources. This was the most financially rewarding application because it was really, it turns out that we are able to predict the patient no-show at high accuracy and send it to the call center. And some patients, especially senior patients, they want just phone calls, actual person to call them. Especially senior, they want somebody in Arabic language to tell them, يا أمي أنت جاي على المستشفى عندك موعد عندك أحد يبي يجيبك كذا. It turns out this is very crucial. They don't want text message. They don't want a reminder notification on their phone, etc. Especially like also in no-show, we found that patients, some patients have anxiety level, especially in the first 2 appointments. Then the anxiety level goes down, then goes up, etc. This profile, sometimes patients, they don't want to know about their side effects or future treatment plan because they are worried. OR scheduling, we'll talk about it in a second. So trauma, we talked about medical imaging AI, the chest x-rays, organ segmentation, lung fibrosis, rare diseases for dysmorphic features of the face that has not been deployed. We send it to Sadaya, Saudi Data and AI Authority to test it in other hospitals. But now the radiology AI, I would say one of the very active AI departments in the hospital in terms of AI. The other department that's now catching up is pathology. We reviewed recently digital pathology platforms. We have digital pathology in KFSH Medina, but now we are deploying one or evaluating 2 for KFSH Riyadh. And one of the main challenges is governance and regulations. We were unable to identify an AI, digital pathology AI platform that was tested on Saudi Arabia data. There wasn't one that's actually in compliance with Saudi FDA regulations. So we are pushing now them like to, you know what, we need to partner with us, and you have to give us like some time for licensing for free, because we are bringing you to the Saudi Arabia market to get the Saudi FDA through testing your platform with us. So now the digital pathology and the pathology department and us, we're working heavily on the digital pathology AI platform, which will cover tons of cases, especially like related to cells, bloods, etc. All this stuff is covered. The situation awareness system platform, we deployed, this is like built totally, everything I'm talking about like so far is built in-house, especially exceptional to the medical imaging. Situation awareness, we built in-house home, from check-in to discharge, or from check-in to door to admission. This is like a patient journey in the hospital. And this is like actually monitoring a lot of hospital KPIs in that platform in real time. And initially it was beautiful, and we'll show you like in a second why we are changing routes. Let me actually go to the, okay. So initially we built this situation awareness, and we built it in a way that will match exactly what clinicians expect. So they will tell us the patient journey in my clinic is step 1, 2, 3, 4, 5. But then later on, we found actually when monitoring the data, we found patients go to step 1, check in, but then they skip patient, they disappear from the system somewhere, and then they go to step 3, then appear in step 5. So we built an AI application that will take all the data in the hospital and plot the actual patient journey. And that's actually now being a startup company, Saudi startup company as well. So we plot the actual patient journey, and it was very interesting. Patient journey in the hospital sometimes go in circles, and they spend 3-4 hours in one clinic, in one waiting area, where they actually supposed to be in total different location. So that's actually the platform that we should be looking at if we want to improve the patient journey in the hospital. And this actually will be deployed very soon in our Riyadh and Jeddah command centers. So we talked about OR, operating room utilization, and this is actually now live system we built in-house, predict how much time each doctor will need for a certain patient and for a certain procedure. And that's like very interesting to see actually the variation among physicians based on the patient cases, based on the doctor profile. And it's very interesting also to see how we address underutilization of rooms. Doctors sometimes book a room for 2-3 hours, at the same time they use it just for 1 hour. So that's like a wasted 2 hours. And then we also found the other way, doctors who book the room for 3 hours and they use it for 5 hours or 7 hours. That's like a cancellation for the patient after him. And then we linked this to also predict a model for supplies. So we saw actually how doctors use supplies per procedure. we found that actually some doctor for same procedure, for same patient profile, very similar patient profile, the supplies or the cost is like this much compared to other doctors. That's like now also built in the OR department and currently monitored by the chairman of the OR unit. This is now very active work in the hospital, which is using content generation capabilities, Gen AI. So what we call like now ChatGPT, etc. But we're trying to do it on premise, because like that's like actually the challenge. That now we can still ChatGPT, Gemini, etc. are not approved by the Saudi Arabia government regulations to be utilized for medical data or sensitive data in general. So we build like now multiple applications this year, 5 AI agents. One of them is the patient case review. In the patient admission department, referral department, we review all the patient cases, provide recommendations instead of the manual review. Data agent and information lookup. This is also a part of our data analysis, self-service data analysis.
Just a minute.
Yeah, 1 minute about the governance. I will conclude with it. So the governance is now the most challenging step. We cannot accept any AI vendor. It must be like Saudi regulated and must be like compliance with regulations, and there will be auditing like dimension, which is gonna impact all the hospitals' JCI accreditation in the future, because now they added it. So any application we post must have or deploy must comply with these regulations. This is our plan for all centers of excellence in the hospital. And with that, I would like to conclude with the same concerns I think Dr. Adina mentioned, and I would like to thank you all. This is actually the experience, 5-year-old experience, from total rejections in the clinicians to now innovators, and they have startups. And I would say AI is not the goal. I have seen like some KPIs like deploy 3 AI models. So if you are like 5 AI models, you are better than 3 AI models. It's not like that. AI is just a tool, and the goal is to enhance healthcare. Thank you so much. Appreciate it.